If you are currently shopping for Medicare supplement insurance online or wherever, you're probably asking yourself, what is Medicare Plan F? I heard about this 100% coverage that's supposed to be all the rage. Well, I'll tell you what Plan F is and what it isn't, who can get it and who can't, because it's not available for everybody. So Medicare supplement plans do just that. They supplement Medicare. What does that mean? Well, Medicare Part A and B have gaps in them. Now, gaps are defined as expenses. Simply put, they have deductibles, coinsurance, and copays that you are required to pay. A Medicare supplement plan can help pay all or most of those gaps for you. In the case of a Medicare Plan F, well, boy, you got the granddaddy of coverage. You walk into any doctor, specialist, or hospital anywhere in the country that takes Medicare, show your Medicare card and your Plan F card, and you walk out the door. You don't get a bill. Basically, you'll get an explanation of benefits in the mail that says Medicare paid this much, Plan F paid this much, you owe nothing. However, that comes with a cost, and it's not available to everybody now. See, on January 1st of 2020, Medicare eliminated Plan F. Now, if you had Medicare in effect prior to that date, you could keep your Plan F, as most of you know who still have it, or you can still enroll in a Plan F if you had Medicare prior to January 1st of 2020. Anybody new to Medicare on or after that date is not allowed to enroll in a Medicare Plan F. Now, why is this? Well, Plan F, as I just described, is what's called first dollar coverage. You could literally get a Plan F and go to the emergency room the day your coverage began for the sniffles, and it's 100% paid. Now, what does that mean in terms of the real world? Well, it means people overused it like crazy, and it became very expensive. And when they looked at the numbers, they being Medicare and the government, they said this plan is just simply too expensive, and we need to offer other plans where there are more cost sharing or deductibles, things like that, the patient is responsible for, rather than just walking in carte blanche and getting everything paid 100%. So for your folks who are just turning 65 or coming on to Medicare for the first time, maybe you're retiring a few years later and you're over 65, no, you cannot get a Plan F. Is that a bad thing? Absolutely not, in my opinion. There are better plans that have lower rates and lower rate increases, particularly Plan G and Plan N. Now, Plan G is the most popular plan by far. The only difference between Plan F and Plan G is on Plan G, you pay the Medicare annual deductible yourself each year. So in 2020, that deductible amount is $198, expected to go to about $205 or $210 next year. We're not sure yet. 2020 is right around the corner. They haven't released the numbers yet. Stay tuned because I'll be putting out a video on that the moment they do. With Plan G, you pay the first $198 of your medical bills this year. After that, it pretty much turns into a Plan F, 100% coverage. However, the premiums for doing that are much lower than Plan F. So you didn't miss out on anything. Now, Plan G and Plan N, again, as I mentioned, the most popular plans. Plan N is a couple additional out-of-pocket expenses, but even lower premiums than Plan G. Watch all my other videos. I've got Plan G videos, Plan N videos, you name the topic, I've got a video on it to help you first learn about the different Medicare supplement plans and which one would fit your needs the best. Once you watch those, or even now, feel free to give us a call, because what we do is we are independent online agents. That means we represent all the top companies. We don't work for any of them, and we certainly don't work for just one like many agents out there. Why is that a benefit? Well, it allows us to shop them all for you and find you the lowest premiums every year, and you never pay us a dime for it. So it's a great service. We've been doing this 11 years. Our clients love it. You're going to have to work with an agent when you're ready to sign up for a Medicare supplement plan. And again, for you folks new to Medicare, that won't be a Plan F, and that's okay, because I'll find you the lowest premiums on Plan G, or we'll discuss Plan N and see if that works for you as well. But again, you never pay for our services. We're there for you every year because every company has the exact same coverages. They all charge different rates for them, and they have rate increases every year. If you don't have somebody on your side to help you find the lowest premiums, you will be like some of the people calling us every week who are paying far more than they should, many paying far more than they should for years and years because their agent never called them back. So let us help. Again, my name is Russell Noga with MetaSups.com. Let's get you on the best plan. Whether you have a Plan F now or you're just coming onto Medicare and you're new, give us a call at 1-888-891-0229. We'll get you in the best spot with your Medicare supplement insurance now and for